तो सबके लिए हम मुंजारो लेकर आए हैं।
Oh, nice. Okay.
सो अब तक हम बात करते थे वेट लॉस के लिए कि आपको डेली इंजेक्शन लगाना है, वेट लॉस के लिए टैबलेट लेनी है। नाउ अब है मुंजारो, जो कि हम वीकली एक बार लेते हैं,
Okay.
एंड इट हेल्प्स इन द वेट लॉस।
Beautiful. कहाँ मिलता है ये मैजिकल?
दिस हाँ यूजुअली आउट ऑफ स्टॉक रहता है, डिफिकल्ट टू गेट,
Okay.
बट इंटरनेशनल मॉडर्न हॉस्पिटल में अवेलेबल है,
Okay.
एंड इट्स रियली गिविंग गुड रिजल्ट्स।
Right.
इट ऑल्सो क्योर्स डायबिटीज। डॉक्टर आमना वुड लाइक टू एक्सप्लेन मोर।
So ये जो वर्ड है मुंजारो, ये कहाँ से आता है? Is it an Ayurvedic medicine? Is it a?
No, it's not Ayurvedic medicine. It's
Okay.
same brothers and sister of all the injections which have been there in the market.
Okay.
Yes.
So basically, it's a peptide. Trizeptide is the name, the compound name which it contains, and it's an injection which comes in the form of a pen. So the first thing that they were using it for was for type 2 diabetes. So जो भी patients को type 2 diabetes है, जिनका के insulin levels कम रहता है और glucose levels high रहते हैं, तो टाइप 1 और टाइप 2 डायबिटीज़ में थोड़ा डिफरेंस ये होता है कि टाइप 1 में जो है इंसुलिन प्रोड्यूसिंग सेल्स ही नहीं होते, तो टाइप 2 में द सेल्स आर देयर बट द प्रोडक्शन इज नॉट हैपनिंग एडिक्वेटली, दैट्स व्हाई द ग्लूकोज लेवल्स गो हाई. So type 1 is since birth we say it's genetic most of the times, and type 2 is when which is more commoner when we get it when we grow old, or when we have grown up to an age. So for type 2 diabetes where the levels are little low for insulin, this gives a boost to reduce the glucose levels along with the diet and exercise the doctors were using it for. So this injection, few people in some other parts of the world have also been used for diabetes. Initial use for diabetes and weight loss together, and then they saw that in few patients who are non-diabetic but they are on a higher side of their BMI, they also used it and it quite helped them. So we have certain hormones which are GLP and GAP in our intestine, so they regulate our hunger, and we have a center in the hypothalamus which is in the brain that regulates our appetite and our hunger. So this trizeptide or Mounjaro injection, it regulates them and increase your metabolism and reduces your hunger. So if we combine it with diet and exercise, it does helps in reducing weight. There were trials based upon that. These injections have come into play, and they are very recent trials. So few of the trials which are done in fact in 2022, they say that the people who have not used the injection and tried some other ways, basically any other injection or any other way of losing weight, for them if the weight loss was 3% of their body weight, and in the patients who are using Mounjaro, the weight loss was 15% of their body weight. So they came up with this study that it helps in weight loss.
This is amazing. In fact, ये आपने इतना टेक्निकल अच्छे से समझाया, यही आप हिंदी उर्दू में okay, just kidding. But कि जो percentage value, it can go from 3 to 15%, and this is just one time, is it?
So weekly injection लेना है, and the doses gradually doctor increase करते हैं. Results are good, especially for type 2 diabetic patient. बहुत से डॉक्टर्स नॉन डायबिटिक में भी यूज़ कर रहे हैं, एंड अच्छा रिजल्ट आ रहा है. रिसेंटली दुबई में आया है मेडिसिन, एंड वी आर एबल टू हैव इट, एंड द पेशेंट्स आर अप्रोचिंग अस टू टेक इट. एंड अपार्ट फ्रॉम दिस, योर क्वेश्चन वाज मल्टीविटामिन.
Correct.
Multivitamins are like brothers and sisters for the weight loss.
Okay.
Always remember. Back hand पे जो लोग काम कर रहे होते हैं, so whenever you are taking multivitamin, it helps in losing weight. Some of the multivitamin, like when we talk about B1, B12, they help in converting the carbohydrate into energy. Otherwise, it get converted to the fat.
No, but
ये
what
तो
about
मतलब
taking
magical है
them
यार, ये तो.
off the table without getting it prescribed? And yesterday, in fact, एक proper clip हमने बजा दी थी on multivitamins, on people saying that can they be just taken off the table,
No.
just going to a chemist
No.
and knowing what you want to buy?
Should never be doing like this. Many people think it's a necessity and they should be taking now. Overdose of multivitamin is very dangerous, which people don't realize. So it's better to consult a doctor, get yourself evaluated, and then that's why many times patient comes to us and their vitamin D, someone told them their vitamin D is required in Middle East because हमें sun से मिलता है vitamin D, and they keep taking. So we have incidences where patient came with toxicity of vitamin D or that have been
Is
taking.
that detrimental?
So
Yes.
yes. So
इट इज काफी लोग ये भी करते हैं कि बिकॉज यू नो कॉस्ट ऑफ मेडिसिन इंडिया में चीपर है तो वो मल्टीविटामिन वहां से लेके आते हैं जैसे सुपरडिन के भर भर के पैकेट्स आते हैं तो
Right.
इज दैट रिकमेंडेड
no, because always remember cost जब कम होती है तो always there is a reason why. Okay, it's a developing country, but हमेशा cost आ जाती है how the medicine is stored, at what temperature, what quality it is maintained, what FDA approved it has gone through. There where the cost comes up.
Right.
So there is a huge difference in the quality also. I'll not say all the medicines, but some group of medicines are like this. So you have to be careful instead of, and there's a reason why those medicines are not available. Here, the law is very strict for the hotels and restaurants and the hospitals.
Right, this conversation is getting really interesting, Dr. Rohit and Dr. Amna. We're talking about weight loss journeys, and we're talking about a special sort of an injection that is available at International Modern Hospital. We will talk a little bit more about this.
डॉक्टर रोहित आबिद का सवाल आया है व्हाट इज द रिकवरी टाइम ऑफ गायनोकोमास्टिया सर्जरी कैन वी हैव सर्जरी डन ऑन सैटरडे एंड जॉइन ऑफिस बैक ऑन मंडे एंड हाउ मच विल इट कॉस्ट
So, to all the listeners, gynecomastia is the males में जो breast होता है वो gland enlargement को gynecomastia कहते हैं. So that is there, and sometimes it's hormonal disbalance and it is seen in teenagers, and then we observe them. But and also it is seen in bodybuilders. So many of these bodybuilders they go to gym and they are trainers who misguide them and they take some injections, testosterone and other to get the muscle bulk. This is a side effect of that. They get the excess hair growth on the body, hair loss on the scalp, and developing a gynecomastia when they stop or during taking the medicine. उसका surgery हो जाती है, and it's a small procedure. You come in the morning, go home by evening, and yes, आप अपना काम पे ज्वाइन कर सकते हैं विद इन 2 days. ओनली अ थिंग इज हम एक कंप्रेशन गारमेंट पेशेंट को खरीदने के लिए बोलते हैं सर्जरी से पहले. दैट्स लाइक अ बाइंडर जो कि उसको पहनना पड़ता है दिन के टाइम में फॉर 3 months, क्योंकि हम जो स्किन और मसल के बीच का फैट निकालते हैं वी वांट द स्किन टू स्टिक नाइसली एंड डोंट वांट एनी फ्लूइड टू एक्युमुलेट, तो वो पहनना होता है. कुछ पेशेंट्स में एक आध ड्रेन डालते हैं जो कि 1-2 दिन में हम निकाल देते हैं. रिकवरी टाइम इज गुड एंड ही कैन जॉइन बैक इन 2 days, and cost is not much. It costs around 12 to 14,000 dirham for both sides.
राइट और अगर आप एक दिन उन्हें सिक लीव चाहिए तो वो सर्टिफिकेट भी आप दे देंगे उनको मतलब
We usually give 2 weeks sick leave.
Got a question from Dia right now. उन्होंने पूछा है कि गुड मॉर्निंग डॉक्टर रोहित डॉक्टर रामना वंडरफुल इन्फॉर्मेशन ऑन वेट लॉस. I was considering to consult a doctor for Mounjaro injection for my husband.
Right.
Are there any side effects for the same?
No, there are no side effects, and Dr. Ines is there, and no major side effects. And Dr. Ines, our endocrinologist, is the right person, because many times you go and consult a doctor and you don't get the medicine, your consultation goes waste. So
Right.
best is to come to International Modern Hospital, consult the endocrinologist, and she'll help you out.
Right. And doctor, who should consider themselves for these injections?
As per the FDA, which approves the medicines here, it's generally considered for patients with type 2 diabetes mellitus and patients with type 2 diabetes mellitus and obesity. So it is generally considered for them, not for general population for now here. And it does lower their glycosylated hemoglobin levels, which in common terms is a test which we do for checking the blood sugar control in diabetic patients. So it has few values, and generally in diabetics the value is higher than the normal individuals. And when they start this injection, the doctor regularly checks these levels, and they generally come down. And with diabetes, a lot of patients gain weight, and they are overweight or obese, so it helps them to lower down their body levels, or body weight as well. So at International Modern Hospital, it's available to be prescribed by our internal medicine doctors, which are physicians as well as endocrinologists.
Right. And is this self-medicated? I mean, do you need to come to the hospital to get yourself those injections, or are they available on countertops where you give them, prescribe them to the patients, and they can do this at home, like you take your insulin shots?
Yes, they can take it by themselves, but when they come to the doctor, they get it from the pharmacy, and the doctor explains them how to take it. It comes in the form of a pen with a cap in it, and a small needle can be attached to it, and there is a small window on the pen which tells you the doses. So the starting dose for Mounjaro is 2.5 milligrams. So maybe you rotate the pen. The first dose will be 2.5, and you have to give yourself, but the doctor can tell you how you will be giving it under the skin, just the way you give insulin to yourself. And then next week you can give it by yourself. So the doses are like, for first 3 weeks the dose stays the same, which is 2.5, and then the doctor may tell you to increase it to the next level, which is 5. So it's easy to rotate the pen and reach to the next dose, but the doctor will tell you exactly which week you have to change the dose, and then at what level your he or she is going to check your blood sugar.
Why is that so? Why week on week is the dose changing, and why not constant?
Okay, so we have to start from the lower level of the dose, the minimum dose, and we have to check. As we mentioned, there are no major side effects, but there are some side effects, and any medications which we are thinking that they will change a metabolism in your body will vary from person to person. So it's not a surgery. Like when we do a surgery for weight loss, we expect a certain results, and that is like 100% guaranteed. Here we are giving injection to make some changes in your body physiology. For example, we want your metabolism to be faster. Now if we take two individuals, their metabolism will vary. So someone may need a higher dose, someone may be all right, and their blood sugar levels and their weight can be controlled at a lower dose. So before reaching to a higher dose, body has to get adjusted, and that's how we start from a lower dose, and then we keep a check, and then we regulate the doses, same like we do for insulin. Like if someone is diabetic, we will not give high dose of insulin suddenly. We'll start from lower, we'll check, and then we may increase or decrease as per the need.
Right. And doctor, is this lifelong process? Because I know insulin is a lifelong process. Is this a lifelong process? If I stop the Mounjaro injection, will I gain weight?
Definitely, there are studies proving that people who have stopped, they have regained some weight back. As I said, it's not a surgery that you will lose, and even in surgery also, you have to maintain, if you are only considering the weight and not the diabetes, because for diabetes, if you are asking, then once your level gets regulated, then the doctor may ask you to taper it or you to continue. But if you are only using for weight loss, yes, definitely there are no studies proving that you have to take it lifelong. And once you stop, you have to do some kind of exercise and diet to keep your weight to the level.
Right. And also moving forward now, is this has this been proven anywhere that this won't cause any harm to people with other problems, like they have kidney problems, or they have a liver problem, or they have another transplant? Can they take it in conjunction with the other health problems?
Yes, it can be taken, but that's why a close follow-up is required, and that's why we ask them to consult a doctor and not to self-medicate. It cannot be self-medicated because it is not available over the counter. Needs a prescription, so where the doctor monitors closely and is taken care.
इस पे और डिटेल्स हम जानेंगे. If you have any questions, do let us know. And Dr. Rohit हमारे साथ. You can also log on to rohitkumar.com to know more.